The Nervous System, Chapter 5, page 107 for medical terminology in a flash. Structure and function. The nervous system plays a key role in maintaining homeostasis, the state of dynamic equilibrium in the internal environment of the body. More complex than the most advanced computer, the nervous system is capable of storing vast amounts of data as well as receiving and sending thousands of messages throughout the body instantly and simultaneously. While the nervous system functions as a total system, you may find it more easily understood if we divide it into two major parts: the central nervous system, the CNS, and the peripheral nervous system, the PNS. However, we first begin by looking at the most essential element, the neuron. A nerve cell, known as the neuron, is illustrated in 5.1. Neurons vary in size and shape, but they all have the following key parts: the cell body, the axon, and the dendrites. The cell body houses all the microscopic structures and that keep the cell energized and functioning. The dendrites, which resemble the branches of a tree, are responsible for receiving information from internal and external environments and bringing this information to the cell body. The axon sends electrical impulses and transmits signals to other cells. The axon may be short or quite long and is sometimes covered in a spherical protective layer called the myelin sheath. Flashpoint. Your brain is something like a very complex computer with infinite data storage capabilities. There's a picture on page 108 of a nerve cell, or a neuron. The central nervous system comprises the brain and the spinal cord. This is where data storage and information processing occurs. The brain is made up of three major divisions: the cerebrum, which makes up the largest portion, the cerebellum, and the brainstem. The cerebrum is divided into two hemispheres called the left and right brains. They are connected by a structure called the corpus callosum. The surface of the cerebrum, called the cortex, is characterized by deep folds and shallow grooves which increase its surface area and maximize function. The cortex is full of neurons as well as specialized support cells that carry nutrients to the neurons called the glia. It is divided into four areas known as frontal, temporal, parietal, and occipital lobes. Each of these areas is responsible for specific functions such as sensory perception, movement, emotions, memory, and behavior. The cerebellum is sometimes called the little brain. It is located inferior and posterior to the rest of the brain. It is about the size of your fist and is shaped like a walnut. It also has folds and grooves similar to the cerebrum. It is responsible for posture, balance, and coordination. The brainstem sits anterior to the cerebellum and includes the medulla oblongata and the pons. It is an essential pathway that conducts impulses between the brain and spinal cord and controls autonomic functions such as breathing. The brain is enclosed and protected by hard bones of the skull, known as the cranium. The spinal cord extends from the base of the brain down to the second lumbar vertebrae and is surrounded and protected by the vertebral column. It is divided into sections that correspond to the vertebrae and paired spinal nerves. The spinal cord provides the pathway for sensory impulses going to the brain from the rest of the body and motor impulses coming from the brain to the rest of the body. Protecting both the brain and the spinal cord are three membranes called the meninges. The meninges provide a supportive structure for many small blood vessels on the brain's surface. They also protect the brain and spinal cord, housing cerebrospinal fluid that continuously circulates and provides a cushion against injury from impact and sudden movement. A nerve cell in the human body functions somewhat like an electrical cord in your home. In an electrical cord, the wires are protected by a rubber coating of insulation. So too, your nerves are protected by myelin sheath. MYELIN sheath. The electrical cord sends electricity from the energy source to the refrigerator, television, or other device so that it can operate. Your nerve cells send electrical impulses down the axon to muscles, organs, and other tissues in the periphery so that they can function. When the insulating layer of an electrical extension cord becomes frayed or otherwise damaged, the cord may short out. As a result, signal transmissions may be temporarily or permanently lost, and the device may no longer work. Similarly, if the myelin sheath on the axon degenerates or is damaged, the electrical impulse may be temporarily or permanently lost. As a result, the organ or muscle that it innervates may not function properly. This explains some of the symptoms caused by degenerative neuromuscular diseases such as multiple sclerosis. Flashpoint. Many people believe that they are either left-brained or right-brained. While the two hemispheres have somewhat different functions, dominance is related to the tasks we are trying to accomplish, not to the type of person we are. Page 11, Box 5.1, Traumatic Brain Injury, Facts and Prevention. Traumatic brain injuries, TBIs, are most commonly caused by falls, being hit by an object, or motor vehicle accidents. According to the CDC, 138 people in the United States die every day from injuries that include TBI. Survivors can have impairments that may last for a few days or for the rest of their lives. There are many ways a TBI can affect an individual depending on where their brain was injured. For example, an injury to the front of the brain or the frontal lobe may cause problems with decision-making, problem-solving, behavior, and self-control. An injury to the cerebellum at the back of the brain may cause problems with balance and coordination. Other areas of the brain control emotions, memory, speech, language, comprehension, object recognition, and more. Many TBI survivors require long-term rehabilitation. Their injuries may be life-changing events that also impact their families, their jobs, and their ability to interact in the community. The CDC reports that from 2006 to 2010, 40% of TBIs in the U.S. were caused by falls. In children 0 to 14 years old, 55% of TBIs were fall-related. A helmet should be worn by anyone who is participating in activities such as skiing, snowboarding, or skateboarding, and when riding on open, unrestrained vehicles such as bicycle, motorcycle, or snowmobile. Motor vehicle accidents, MVAs, are the leading cause of TBI-related deaths for children and young adults of 5 to 24. When riding in cars, child safety seats should be used, seatbelts should be worn, and drivers should not operate the vehicle under the influence of alcohol or drugs. Even some prescription medicines can affect a person's ability to drive safely. In adults aged 65 and older, 81% of TBIs are caused by falls, and the falls are the leading cause of TBI-related death in this age group. More than half of these falls occur in the home. It is a myth that falling is a normal part of aging. Communities throughout the U.S. are offering comprehensive fall prevention programs as Stepping On that teach older adults how to recognize and remove hazards in their homes and how to decrease the risks of falls through regular vision checks, medication reviews, use of assistive devices, and regular exercise. For more information about fall preventions or Stepping On programs, visit the CDC, cdc.gov. Central and peripheral nervous systems on page 111. The central nervous system, brain and spinal cord, is located in the middle, or the most central part of the body. The peripheral nervous system is located outside or peripheral to the CNS and includes the nerves in the arms and legs. The PNS includes 31 pairs of spinal nerves, 21 cranial nerves, and the nerves in the arms and legs. Almost all nerves are part sensory and part motor. Some cranial nerves are all sensory and all motor. Sensory nerves gather information from the skin, muscles, and joints. The information includes sensations such as temperature, touch, pressure, movement sense, position sense, and pain. These sensations allow us to distinguish between sharp and dull and to recognize different weights, shapes, and textures of objects. This sensory information is sent to the brain, and the brain responds by sending messages back out to the body via motor nerves, which control body movement. The message may be a conscious one that promotes you to action, such as putting on a coat if you're cold, or it may be unconscious, causing you to reflexively lift your foot if you step on something sharp. A key function of the 31 pairs of spinal nerves is innervation of the skin and muscles of the limbs. Areas of the skin associated with specific spinal nerve roots are called dermatomes. Groups of muscles associated with specific spinal nerve roots are called myotomes. Dermatomes have two meanings. As you learn in Chapter 4, a dermatome is also a surgical instrument that produces thin slices of skin. In injuries such as compression of a spinal nerve root, pain is felt along the associated dermatome rather than the actual site of injury. This is referred pain, and other symptoms such as numbness and tingling are felt in your arms or legs rather than in your neck or back. Injury to spinal nerve roots may also cause muscle weakness in a group of muscles away from the site of the injury. An injury to spinal nerve root in the neck may cause weakness of the wrist muscles, and an injury to the spinal nerve root in the low back may cause weakness in the ankle muscles. An important part of the PNS is the autonomic nervous system, ANS, which controls involuntary functions. It consists of motor nerves to smooth muscle, cardiac muscle, and glands such as sweat glands and salivary glands. It is further divided into the sympathetic and parasympathetic nervous systems. The sympathetic nervous system is responsible for the survival response known as flight or flight response. This response prepares a person for action, whether it is to fight in self-defense or run from danger. Physical changes within the body causes this response include increased heart rate and force, increased blood pressure and glucose, bronchodilation, and decreased intestinal peristalsis. These changes provide the body with increased energy and oxygen while slowing some functions such as digestion, which are less important at the time. The parasympathetic nervous system essentially creates an opposite response and dominates during non-stressful times. Some of its effects include decreased heart rate, bronchoconstriction, and increased peristalsis. The next few pages are mostly maps of the body, brain, nerves, so definitely take a gander at the diagrams available on the pages starting on 108. Page 120, combining forms pertain to the nervous system. Examples of the terms that utilize the combining terms in a pronunciation guide. So there's a table like cephalalgia. Definitely need to learn that. There's more abbreviations. Skipping the diagrams and images and tables to page 124. Pathologies, procedures, and pharmacology. Table 5.3 lists terms that relate to diseases or abnormalities of the nervous system. Alzheimer's disease is a form of chronic progressive dementia caused by the atrophy of brain tissue. Amyotrophic lateral sclerosis, Chronic progressive degenerative neuromuscular disorder that destroys motor neurons of the body, also called Lou Gehrig's disease, aka ALS. Bell's palsy, form of facial paralysis, usually unilateral and temporary, also known as facial palsy. Brain abscess, collection of pus anywhere within the brain. Brain tumor, any type of abnormal mass growing within the cranium. Cerebral concussion, vague term referring to a brief loss of consciousness or a brief episode of disorientation or confusion following a head injury. Cerebral contusion, which is the bruising of brain tissue. There are two images. Contracoup, which is a skull hitting on the forehead and the brain is moved to the back. So there is a cerebral contusion, which is at the back of the head. There's a coup, which looks like a whiplash, where the brain is hitting on the frontal lobe, which is the contusion. Cerebral palsy, group of motor impairment syndromes caused by lesions or abnormalities of the brain arising in early stages of development. Page 126. Cerebrovascular accident, aka CVA, damage or death of brain tissue caused by interruption of blood supply due to a blood clot or vessel rupture, also known as a stroke. Delirium, acute reversible stage of agitated confusion marked by disorientation, hallucinations, or delusions. Dementia, progressive neurological disorder with numerous causes in which an individual suffers an irreversible decline in cognition due to disease or brain damage, sometimes called senility. Depression, mood disorder marked by loss of interest or pleasure in living. Encephalitis, inflammation of the brain, often combined with meningitis, then called encephalomeningitis. Epidural hematoma, collection of blood between the dura mater and the skull. Epilepsy, chronic disorder of the brain marked by recurrent seizures, which are repetitive, abnormal electrical discharges within the brain. Guillain-Barré syndrome, GBS, acute inflammatory disorder that causes rapidly progressing paralysis and sometimes also sensory symptoms, also known as inflammatory polyneuropathy and acute infective polyneuritis. A variant of GBS is Miller-Fisher syndrome. Huntington's disease, hereditary, progressive degenerative nervous disorder that leads to bizarre involuntary movements and dementia, also called Huntington disease or Huntington chorea. Meningitis, infection and inflammation of the meninges, the spinal cord, and CSF, usually caused by an infectious illness, often combined with encephalitis, then called encephalomeningitis. Migraine headache, familial disorder marked by episodes of severe throbbing headache that is commonly unilateral and sometimes debilitating. Multiple sclerosis, disease involving progressive myelin degeneration and results in a loss of muscle strength and coordination. Neural tube defect, incomplete closure of the spinal canal, which may allow protrusion of the spinal cord and meninges at birth, leading to paralysis, known as spina bifida. Parkinson's disease, progressive degenerative disorder that results in tremors, gait changes, occasionally dementia. Parkinsonism is a condition that resembles Parkinson's disease. It has a different cause, such as medication, and symptoms can stabilize and improve. Peripheral neuropathy. Dysfunctions of nerves that transmit information from the brain and the spinal cord, characterized by pain, altered sensation, and muscle weakness. Inflammation, poliomyelitis. Inflammation of the spinal cord caused by virus, which may result in spinal and muscular deformity and paralysis. Reyes Syndrome. Reyes Syndrome. Serious disease associated with aspirin use by children with viral illness, which may result in permanent brain damage or even death. Sciatica. Pain, numbness, weakness, or tingling that is felt from the lower back along the pathway of the sciatic nerve into the legs. Shingles. Unilateral painful vesicles occurring on the upper body caused by herpes zoster virus, also called herpes zoster or vona. Spinal cord injury, SCI. Traumatic bruising, crushing, or tearing of the spinal cord. Spinal stenosis, narrowing of an area of the spine that puts pressure on the spinal cord and spinal nerve roots. Subdural hematoma, collection of blood between the dura and the arachnoid layer. Tension headache, non-migraine headache in which pain is felt in all or part of the brain, or part of the head. Tetanus, non-contagious illness marked by severe prolonged spasm of skeletal muscle fibers, also known as lockjaw. Transient global amnesia, TGA, rare disorder not caused by a neurological event or injury that causes sudden temporary loss of memory. Transient ischemic attack, TIA, temporary stroke-like symptoms caused by a brief interruption of blood supply to the part of the brain. Traumatic brain injury, TBI, injury to the brain following a blow to the head, commonly caused by a fall or motor vehicle accident. Trigeminal neuralgia, neurological disorder that causes severe episodic facial pain along the pathway of the fifth cranial nerve, also called tic douloureux. Common diagnostic tests and procedures. Cerebral spinal fluid analysis. Analysis of the CSF for blood, bacteria, and other abnormalities. Computed tomography. CT scan. Study of the brain and spinal cord using radiology and computer analysis. Electroencephalography. Study of electrical activity of the brain, which is EEG. Electromyogram, EMG. Record of muscle activity from electrical stimulation. Lumbar puncture, LP. Puncture of the subarachnoid layer at the fourth intervertebral space to obtain CSF for analysis. Magnetic resonance imaging, MRI. The use of an electromagnetic field and radio waves to create visual images on a computer screen. Myelography. Radiography of the spinal cord and associated nerves after intrathecal injection into spinal canal of contrast medium. So there's some additional photos of the spine. There is pharmacology on page 131. And that is the end of chapter 5. But there's actually quite a bit of learning to do with the images and definitions, abbreviations, and pharmacology.